According to the official statistics, more than 330,000 Americans have died of coronavirus this year, but not everyone thinks that number's credible. Here's the Grand County, Colorado coroner explaining that some COVID victims also suffered from gunshot wounds.
It's the first time Coroner Brenda Bach has felt so frustrated by a cause of death.
These two people had tested positive for COVID, but that's not what killed them. The gunshot wound is what killed them. I had not even finished my investigation.
When the state listed the gunshot victims as dying with COVID.
So their underlying condition is that they had 3 bullets in their chests. Now, some state legislators in Minnesota who examined thousands of death certificates in their state say COVID deaths might have been overestimated by 40%. State Representative Mary Franson and State Senator Scott Jensen are now calling for a national COVID audit, and they join us. Mary, you uncovered some fairly bizarre alleged COVID deaths, including a person who was thrown from an automobile in a car accident, but somehow that wound up as a COVID death.
Yes, and what it took was some concerned citizens. Now, mind you, we've heard these stories. This is what I think is happening. But some concerned citizens went through the data practice route and requested those data files. They paid for them, passed them on into my hands for me to take a look at and see what they were seeing. And there was a lot of data there, so I enlisted some people that are really good at understanding data, including Dr. Jensen, to go through those death files. And what I found was shocking, because I was just hoping that it was a myth. But indeed, Minnesota is classifying some deaths as COVID when clearly they should not be. Listen, Mark, we cannot have people dying in motor vehicle collisions, suicides, drownings, etc., and being classified as a COVID death. Our state is locked down. Our kids are now going to have to wear masks while playing basketball and hockey. Restaurants are shut down. We can eat at a restaurant, but it's got to be outside. Today in Minnesota, we've got a blizzard. People are losing their livelihoods. We have the greatest transfer of wealth taking place right now, and we need an audit.
Right. Well, Steve, you've been skeptical about this for about 7 or 8 months now, because back in April, you made the observation that in fact, as a doctor, you were being incentivized to exaggerate the number of COVID deaths.
Well, Mark, you're exactly right. And actually, my name is Scott, but I appreciate that. That's my older brother.
I'm sorry. I'm sorry about that. I'm sorry. That was the last time I met you, I think, was with a fellow called, but you're right. You are Scott. My apologies.
Thank you. April, when the Department of Health and the CDC decided to change the rules that had been in place for 17 years, by encouraging the diagnosis of COVID-19 in situations that we never would have otherwise, they were abandoning their long-held commitment to precisely identifying the inciting or the initiating event that would lead to a sequence of events that would lead to a person's demise. When they did that, they opened the door. And I did make it clear that at that point in time, I was very concerned. I don't know why they would do that. There was no conversation with physicians when that took place. And what we saw subsequently was we saw enhanced payments to hospitals for Medicare patients. And then we saw the CARES dollars being distributed. And once again, the old adage, follow the money. And we saw that if hospitals could somehow hit 161 admissions with COVID-19, that they would be eligible for a $77,000 per admission payment through the CARES Act. And they had to hit that threshold between January and June 10th. So I don't think go ahead. I don't think there's any question perverse incentives have been created, and it's frankly the CDC's fault.
No, and that's absolutely astonishing. You're right Scott, and you're also right, Representative Franson, that we need a national audit because somehow we have wound up with deformed causes of death in Minnesota, Colorado, and around the country. Thank you very much for joining us. The state of California has imposed some of the nation's harshest anti-COVID policies. The Golden State canceled Christmas, closed restaurants in its biggest cities, and even Governor Newsom is willing to concede it hasn't worked very well.
Joe Biden last week, right before the holidays, assessed things, I think, correctly. That unfortunately will get worse before it gets better, and I think demonstrably that's the case. And not only as a nation, but clearly as we work through the next 60 to 90 days here in the state of California and anticipate this surge on top of a surge, arguably on top of a surge as it relates to the holiday movement.
California is now the epicenter of this thing. Victor Davis Hanson is a Californian and a fellow at the Hoover Institute, and it's always good to get his take. What's going on here, Victor? Why California? Why now?
Well, it's complicated, Mark. I think we thought that we had done something unusual to escape the brunt of the virus when it hit in March, but I think in retrospect, it was simply we were already into warm weather. We're not, especially for all the population, a dense state, and we kind of escaped it. Even today, we have about a third of the deaths per capita of New York and about 2/3 of Florida and Texas, and then suddenly things got worse, and everybody said, well, now what do we do? But so we went into this lockdown, but the problem with the lockdown was the governor was caught cheating on his own lockdown at the French Laundry at Tony restaurant. So was the mayor of San Francisco. So was Nancy Pelosi. She went to a hairdresser. Then we had the Lakers celebration, and we had the Antifa, BLM, and everybody was out in the street. There was no repercussions. So I think a lot of people said, you know what? They lost confidence in the authority, who now said, well, now you have to lock down. Everybody said, well, you didn't do it then. And then the second thing is, this is not the state of, Menlo Park or Beverly Hills. California's got 21% of the people under the poverty level mark. It's got 1/3 of all the welfare recipients. 27% of the state was not born in the United States. And I'm here on the border of Kings and Fresno County, and the per capita income is about $16,000. So 1 out of every 3 Californians, or almost 1 out of every 3, when they were admitted to the hospital, they're found to have pre-diabetes or diabetes for any reason they were admitted. So we're kind of an impoverished state. We're more like Appalachia than Beverly Hills. So we didn't have a margin of error. And then the cold weather came, and people, as I said, lost all confidence in the authority. And now we're trying to catch up. But we have some intrinsic problems that nobody talks about that makes it pretty hard to weather this virus.
That's true. Thank you for that, Victor. Up next, Barack Obama's reign as the most admired man in America is over after 12 years. Take a guess at who finally dethroned him this year. The answer's coming up. Plus, for 4 years.